Good afternoon and welcome to another Research in Action brought to you by the Division of Research at Florida Atlantic University. Whether you're here for the first time or are a returning attendee, we hope you enjoy this series. We are now scheduled to continue this series at least until the end of the year, so look for a lot more exciting topics that you can listen to. My name is Karen Scapinato. I will be the moderator of today's session. Before we get started, we do not allow verbal questions just because of the number of attendees usually here, but we would like to address your questions. So if you hover your mouse in the bottom of your screen, you will see a Q&A button there. If you push on that button, a little pop-up will come up and you can type your question there. You can type your question at any time during the presentation, but we will address the questions at the end of the presentation. If we happen to not get to your question because we're out of time, we will collect those questions and we will ask our presenter to address those questions offline and post them on our website together with a recording of this presentation. All that can be found on our Research in Action website. With that, it is my great pleasure to introduce today's speaker. Dr. Michael Maniaci is Assistant Professor in the Department of Psychology at Florida Atlantic University. He earned his Ph.D. in Social and Personality Psychology with a certificate in Quantitative Methods from the University of Rochester. His research interests focus on interpersonal attraction and close relationships, including daily social behavior and how people think about their relationships. And with that, I'm going to turn it over to Dr. Maniaci.
Hi, thank you for joining me, at least virtually today. I'm Michael Maniaci, and I'm currently an assistant professor, in a few weeks an associate professor in the Department of Psychology at Florida Atlantic University. I'm going to talk to you about promoting social connection during a global pandemic. Now, before I get into the details of what I want to discuss today, I feel it's important to open by addressing a serious public health issue that has been on a lot of people's minds lately. This is a public health issue that by some estimate severely affects 1 out of 12 people, and to some degree affects about 1/3 of people, at least in industrialized nations. But this condition affects people across countries, across income and education levels, across gender, racial, and ethnic groups. It's a condition that spreads through social networks, and it's a condition that has severe consequences both for emotional well-being and for physical health, including, according to some reviews, a 26% increased risk of mortality within a given period of time, and health consequences that, according to some reviews, are more severe than obesity and smoking 15 cigarettes a day. I'm not referring to the novel coronavirus or COVID-19. I'm referring to loneliness and social isolation. Everything that I just discussed is consistent with research that we know, what we know about loneliness. Some of these points I got from this article in The Lancet by Cacioppo in 2018, but there are many other articles documenting the serious emotional and physical health implications of loneliness and social isolation. That's in part what I want to talk to you about today. I'll come back and give you some more details and context for some of these claims, but first I want to give a quick overview of what I want to accomplish in this talk today. First, I want to introduce you, in addition to discussing why relationships are important, I want to talk about the scientific study of relationships. My own background is in social and personality psychology, which focuses generally on how people influence and are influenced by groups. And my work primarily focuses on close relationships. I believe that the scientific study of relationships is essential and worthy of funding, but I want to talk to you a bit about the nature of the scientific study of relationships. Then we'll talk a little bit more about why relationships are important and the idea that we have a fundamental psychological need to belong. That is a fundamental motivation to form and maintain close, satisfying relationships. When that need is thwarted, that could represent something like exclusion or rejection. It's often experienced as loneliness. So I'll talk more about the nature of loneliness, which is, again, one way that we can experience not having this fundamental need met, and social isolation. And one of the points I'm going to try to emphasize is that loneliness and social isolation are not the same thing. Loneliness is not the same as being alone. On the one hand, that means that loneliness will likely continue to be a serious public health issue even after we have an effective vaccine to help prevent the spread of COVID-19. Loneliness is likely to persist. But it also means that we can prevent loneliness even when we're not physically around people in the way that we were before. So just because we're engaging in social, or what many psychologists like to refer to as physical distancing, we can still make efforts to connect to other people and ensure that our need to belong is met. So if we accept the idea that relationships are important and that they have consequential influences on not only our emotional well-being, but also our physical health and physical well-being, how do we develop close relationships? My intention today, particularly given the amount of time we have, is absolutely not to give you a comprehensive overview of research in this area, but just to give a very selective review of a few topics that I think are particularly important, and then also give you some examples of the type of research that me and my collaborators and graduate students I work with at Florida Atlantic University have conducted on some of these topics. So we'll talk a bit about how close relationships develop, a bit about interpersonal attraction. And I don't just mean romantic or sexual attraction. I'm referring more generally to what are the things that lead us to want to form a relationship with someone, maybe a romantic relationship or a friend relationship. What attracts us to some people more than others? And how do people go about initiating relationships? We'll then shift to, well, if you form a relationship, what next? Is that it? Well, no, it's more complicated than that. In fact, again, I mentioned that loneliness is not the same as social isolation. Many of us have experienced feeling very lonely even when we're in the presence of many other people. So even if you're married and live with several people in your household, you can still experience loneliness, and you can still experience relationship dysfunction and distress. So what can we do to help maintain our relationships once they form? And again, I'm not going to give a comprehensive overview of any of these topics. I'm going to give a very selective review of a few topics that I think are important to emphasize. So, so I'm going to talk about research on close relationships. Research on close relationships is interdisciplinary. It goes far beyond and outside of the field of psychology, although a lot of psychologists and social psychologists in particular focus on relationship research. Psychology is, there are applied areas of psychology, but I believe that psychology is a scientific field. Psychology is often defined as the scientific study of mind and behavior, and psychology has been referred to, often by psychologists, as a hub science. This image is adapted from a paper that looked at patterns of citations. So when someone publishes a research article and they cite papers from their own field or from other fields, we can look at those patterns of citations to get a sense of how fields of science are organized and related. And in this paper, they identified psychology as one of several hub fields in science, meaning that psychology is influenced by, but also influences many other areas. And psychology holds sort of a unique niche in connecting either directly or indirectly to areas that we might consider more traditionally the hard sciences, but also to more applied areas, including medicine, psychiatry, and other areas of the social sciences. Social psychology is the study of how the thoughts, feelings, and behaviors of individuals are influenced by others. But social psychologists have not always emphasized the context of close personal relationships. This is something that Harry Harlow pointed out in his presidential address as president of the American Psychological Association in 1958. He said that our assigned mission as psychologists is to analyze all facets of human and animal behavior. So far as love or affection is concerned, psychologists have failed in this mission. Psychologists not only show no interest in the origin and development of love or affection, but they seem to be unaware of its very existence. Now, at the time, there was research prior to 1958 and in the ensuing decades, there was research relevant to close relationships. And psychologists are certainly not the first people to think and write about and try to understand relationships. There are very rich traditions in philosophy, in religious texts of people trying to understand relationships. But what's unique about relationship science is trying to apply the tools and methods and procedures of the scientific method to try to give us a different window on understanding how relationships operate. In the 1950s and 1960s, there was some scattered work on close relationships, but it really wasn't a core area of social psychology. Psychology, relative to other areas of the sciences, is a relatively new field, a relatively young field, I should say. But the scientific study of relationships as an organized, cohesive field of study is even younger. One of the things I love about going to conferences on relationships is that you can interact with many of the very influential people who helped to sort of build up this field of study. Many of them are still actively conducting research and publishing. So in the 1960s and 1970s, there was a boom of research on attraction and predictors of attraction. There was work going back before Harry Harlow said this, looking at sexual processes. But it was still the case that in the 1960s, 1970s, there wasn't really a cohesive area of focus within psychology emphasizing close relationships. All of that work began to come together in the 1980s, and the situation is very different. Relationships are now a core central area within social psychology and many other areas of psychology and other fields of study. There are conferences and journals devoted just to relationships and understanding close relationships. Research on close relationships is very prominently displayed in some of the top journals in psychology, and it's really a thriving field. That said, it's still a relatively young field, and although we've made quite a bit of progress in collecting data and evaluating hypotheses and building theories, there's still a lot that we don't know. So relationship science and the social psychology of relationships includes many different theories and many different research findings that are often somewhat disconnected. Researchers develop a theory to focus on a particular topic. Someone else develops another theory and a set of findings that sort of help address that. But there are a lot of different approaches that aren't always integrated. We're not anywhere close to having a theory of everything related to relationships. So some researchers have begun to try to take a more integrated view of relationships. And in this article by Eli Finkel, Jeff Simpson, and Paul Eastwick in 2017, they briefly review some of the most influential theories and findings in particularly the social psychology of relationships. mostly focusing on adult relationships and focusing on primarily romantic relationships. And what they tried to do was pull out core principles that seem to cut across a lot of these different, sometimes disconnected theories and research findings and so on. I just want to very briefly talk about a few of these things, but many of these topics I'll come back to for things that we'll discuss later today. Some of these principles involve defining what is a relationship. One broad principle is that relationships are, in a sense, unique. Relationships are more than just the sum of two individuals. If we want to understand a relationship, we can't do that by focusing on the more traditional approach that that people tend to take in psychology, which is to focus on the level of the individual. If we know everything about two individuals, that doesn't necessarily allow us to understand how they would come together in a relationship. In fact, I'll talk about some research in a little while, maybe to some degree questioning how well we can predict attraction and relationship satisfaction and how relationships change just as a function of personality and kind of stable characteristics of individuals. So a core principle in the science of close relationships is that understanding relationships means going beyond the kind of individual perspective and focusing on the two people and how they interact and so on. Another core principle involves what you might call integration, which is the idea that close relationships are defined by what we call interdependence. This is a very common way to define what we mean by a close relationship. So dependence might refer to, if I'm dependent on someone, my outcomes and experiences may be strongly influenced by their behavior and decisions and so on. In a close relationships are often characterized by strong interdependence, meaning both people's outcomes and experiences are strongly influenced by the other person's decisions and behavior, and vice versa. In close relationships, there's often a high degree of kind of mutual interdependence, and that interdependence might apply across a wide range of kind of situations and contexts. A lot of relationship research, in one way or another, builds on what the implications are of interdependence. If your outcomes are sort of intertwined with another person and vice versa, that might be what we would describe as a close relationship. Okay, so a romantic relationship, a close friend relationship. I'm not referring to your interactions with a waiter or your Starbucks barista or a very casual acquaintance. That interdependence has some important consequences. And in some ways that reflects what we might call kind of merging, that in a close relationship, we often begin to not just think of ourselves as kind of disconnected individuals, but as part of a couple. You may have experienced this yourself in a relationship you've been in, or people that you've known who have entered a relationship. They might begin referring to themselves in sort of a plural sense. We are going to do this. We can't come to that event because we're busy, rather than me and her, for instance. And research in social psychology and other fields suggests that merging happens at sort of a very deep level, if you will. Relationships are also characterized by trajectories of change. And so understanding a relationships are not static. We often need to look at how things are developing and changing dynamically, and how the relationship or the people in the relationship adjust to stressors and other things that are changing. So a lot of our understanding of relationships deals in one way or another with dynamics of change. How do relationships operate? Relationships often involve evaluation, and that sometimes that's conscious. We sort of go out of our way to take stock of our relationship, but that also might operate outside of our conscious awareness. But people do seem to sort of track their relationship, and that might be experienced as a sense of being satisfied or dissatisfied. It also includes things like your commitment. To what degree do you intend to continue that relationship? To what degree do you see that relationship as likely to continue into the future? Another core principle that I'll come back to is responsiveness. A considerable body of research suggests in different ways that feeling like a close relationship partner understands important things about you and demonstrates that they care about you is fundamentally important. I won't say anything more about that now because I'll come back to say quite a bit more about responsiveness. Relationships also involve resolution of conflict. Now, when someone says, oh, my relationship is fantastic, we've never once disagreed about anything, my reaction is, well, just wait. Because in a close relationship, when you become interdependent, that interdependence often leads to situations where there are sort of conflicts of interest that can be very difficult to resolve. So in very interdependent long-term relationships, conflict is arguably inevitable, sometimes even what we might call intractable conflict that may not be resolvable. So how people deal with conflict is fundamentally important as well. And relationships also require maintenance. Again, relationships are not static, they're dynamic. And maintaining relationships requires ongoing attention and effort and work. Relationships involve a lot of work to maintain. So we'll talk a bit about some ways that you can maintain your relationship, a few specific topics. But again, I'm not giving a comprehensive overview. I just want to highlight a couple of things. A lot of that work looks at commitment, and what research suggests is that commitment plays a very important role in our maintenance of relationships and in what we do to try to ensure that our relationship will persist. Another insight that's been very influential coming from interdependence theory is that commitment is different from relationship satisfaction. Think about it. Relationship satisfaction is probably important, but I'm sure we all know someone who at some point has stayed in a relationship despite being pretty unhappy or dissatisfied. This might also apply not just to personal relationships, but maybe a workplace relationship. Maybe you stayed in a job, you maintain that relationship with your organization that you worked for despite being very unsatisfied. So commitment is more than just satisfaction. According to interdependence theory, it also depends on whether we believe that we have better alternatives, and to some degree, what we've already invested in our relationship. If we've invested a lot in a particular relationship, that might lead us to feel more committed to it, to have more of a desire for that relationship to continue. In the context of social distancing and COVID-19, I haven't come across research papers on this, but I suspect this is something that's worth attending to, that given that people's social contexts have been disrupted, it's difficult to go out and meet new people and go out on dates when things might be closed or locked down, or you may just be wary of going out in public. That probably has some effect on our perception of what alternatives are available, which may have implications for our relationships. I should also mention that one alternative is maybe not having a relationship. It doesn't necessarily mean that there's an alternative partner that you're interested in. And I'm going to skip over some of these other topics, but several other core principles deal with how the tendencies that we bring into a relationship as individuals. That might include our predispositions, our personality, our individual differences and traits, but also what is sometimes referred to as instrumentality. Relationships are influenced quite a bit by our motivation, our motivation to be in that relationship, but also motivation more generally. I'll come back to this later, but we tend to be attracted to people who are instrumental to us, in the sense that they can help us meet our needs or help us pursue important goals. People also vary in their standards, what ideals they would have for a relationship. And relationships are also influenced by context, both the sort of immediate situational context. Some contexts are more diagnostic of others. So, if both people in a relationship agree about something, that's not very interesting. What's interesting is if they disagree. If one person wants to accept a job that would require them to move across the country and the other person doesn't, as someone who wants to understand relationships, that's what I want to focus on. How do they resolve those conflicts? That can be very diagnostic of how both people sort of feel about the relationship, and other contextual factors like what alternatives are available, stressors, cultural factors. So I want to come back to why relationships are important. I think most people would accept that relationships are important to some degree, but to flesh that out a little bit, psychologists and others have argued that relationships aren't just important because we like them, they're important because we have a fundamental need to belong, or a fundamental motivation to form and maintain social bonds in stable relationships that provide ongoing positive interactions. In a seminal paper by Roy Baumeister and Mark Leary in 1995, they discuss what it means for something to be a fundamental motivation or a basic psychological need. And they review in detail the research that had been published up to 1995, showing that the need to belong, our sense of belonging or relatedness, this fundamental motivation to form and maintain stable social bonds, represents a fundamental psychological need. And research is consistent with this idea that belonging is a fundamental human motivation. Universally, people readily form and maintain social bonds. Social belonging has multiple strong effects on emotion. In fact, when our belonging needs aren't met, we might experience that as a form of pain. Just the language that we use to describe the experience of being rejected or excluded or not having our relational needs met, we refer to it as feeling hurt, having hurt feelings, or experiencing social pain. In fact, researchers have argued that that this represents sort of a potentially evolutionary adaptation, that the experience of social pain may have evolved to help us ensure that our belonging needs are met, and that there might be something sort of real on a neurological level about the idea of social pain or hurt feelings, that the neurological processes that are related to social pain may have actually co-opted the neurological processes that involve physical pain. So there's some interesting, I'm not going to go into the research on that, but there's some interesting parallels, at least, between social and physical pain. Social relationships also guide our cognition, or how we think, how we process information about ourselves and others. I gave one example of merging. We tend to process information and remember things differently depending on whether we're in a close relationship with someone or not. A large body of research suggests that we interpret and remember information about close relationship partners in a way that's pretty similar to how we process information and remember things about ourselves. So cognitively, in terms of how we think about and remember social information, that seems to vary as a function of the relationship context. Additional research that supports belonging as a fundamental motivation shows that when the need to belong is thwarted, there are sometimes severe negative consequences for our physical health and our physical and emotional well-being. the other bit of evidence that supports the need to belong as a fundamental motivation is that when that need isn't met, it elicits goal-oriented behavior that seems intended to reestablish belonging. So think about how other basic physical needs operate. Hunger is generally adaptive in terms of the experience of hunger. When we feel hungry, that's a clue that an important need is not being met. And that guides our emotion, our cognition. It might feel unpleasant. It might lead us to think more about food. And it also activates goal-oriented behavior to lead us to try to meet that need. A lot of basic physical needs operate that way. Well, the idea of a basic psychological need, including the need to belong, is that it operates similarly, at least to some extent. Now, we're able to survive thwarted psychological needs for longer periods of time than we can survive thwarted physical needs like hunger and thirst and so on. But there are important parallels. In the same way that hunger cues us to the idea that an important physical need isn't being met and shifts our attention and our motivation and our behavior to ensure that that need is met, belonging seems to work somewhat similarly. In fact, we'll talk in just a moment about loneliness. Arguably, loneliness is sort of like hunger in the sense that hunger, that negative experience of hunger shifts our attention and motivation to ensure that that need is met. That unpleasant state of loneliness or feeling disconnected orients our thoughts and generally motivates us to engage in behavior to try to reestablish these fundamentally important social connections. Okay, so let's talk a bit about loneliness. Loneliness is often defined as a perceived discrepancy between desired and actual levels of social connection. Here's a brief measure where this is a 3-item measure. Usually we would give longer measures, but I put this here because you can kind of answer these questions for yourself. So answer on this 1 to 4 scale each of these 3 questions, and then just add up the 3 numbers that you choose, and that would be your sort of loneliness score. How often do you feel that you lack companionship? Never, rarely, sometimes, or often. How often do you feel left out? Never, rarely, sometimes, or often. And how often do you feel isolated from others? Hughes and colleagues reported a mean of 6.1 in a sample of adults age 50 plus. I don't have cutoffs for where you would be considered highly lonely or not at all lonely. But if you're answering these questions in the sometimes or often range, you would be on the higher end of loneliness. I think it's important to, again, clarify that loneliness is not the same as being alone. It's not the same as objective isolation or just being around or not being around other people. It's a subjective perception that there's a discrepancy between your desired and actual levels of social connection. Now, actual objective social isolation is also influential in terms of emotional and physical health and well-being. There are health and well-being differences between married and unmarried individuals, although there are also significant differences between happily married and unhappily married individuals. Being in a romantic relation or marital relationship isn't necessarily going to prevent loneliness or ensure that your belonging needs are met. Remember that the need to belong, just to go back a slide, is a motivation to form and maintain stable relationships that provide ongoing positive interactions. So living with someone in a very negative, unsatisfying relationship isn't necessarily going to meet that need. It's also not just about the quantity of interaction. In public health surveys, researchers often will ask about, are you living alone or living with other people? How many people do you interact with on a given day? And quantity of interaction, let's say, How many people are there that you could turn to for support? How many, are you married or not? How many people do you live with? How many people do you interact with on a given day? Those things are associated with perceptions of loneliness. But in many studies, there are much stronger effects for measures of the quality of social interaction. Again, it's not enough just to be around people and interact with people. We have a need for sort of positive, satisfying, and to some degree meaningful interactions. Loneliness is unpleasant, but from an evolutionary perspective, there's got to be a reason that loneliness exists. And many researchers argue that loneliness is generally adaptive in the sense that it supports this fundamental need to belong. But it can also be dysfunctional, okay? Just like physical pain is adaptive. When you experience pain, it orients your attention to something that's problematic. It influences your behavior so you hopefully can address the pain. But those processes can also break down. So if you're experiencing high chronic levels of chronic pain, that can also be very dysfunctional. Similarly, loneliness is generally adaptive. Okay, it's pointing something out that might be problematic that we need to address, but it can also be dysfunctional. So researchers and clinicians often focus on chronic loneliness and particularly loneliness that might represent issues with maybe biased perceptions of things and so on. Loneliness is related to depression. Some measures of depressive symptoms will include an item that essentially asks about feelings of loneliness. To what extent do you feel disconnected from others? And symptoms of loneliness and depression are related to one another, but they're also distinguishable. So as everyone here hopefully knows, the CDC and many other organizations have strongly suggested that we engage in social, or what many psychologists say that we should refer to as physical distancing, to help prevent the spread of COVID-19. According to the CDC, COVID-19 spreads primarily through extended close contact within about 6 feet, through droplets that are spread when an infected person, even someone without symptoms, coughs, sneezes, or talks. The CDC suggests physical distancing outside of your home. And also if someone in your home may have COVID-19, they suggest physical distancing there as well. Now, this is usually referred to as social distancing, but again, psychologists have said really we should call this physical distancing, because the idea is not that we distance ourselves from our important close relationships. We've still got a fundamentally important need to belong. It's just about staying physically distant. So have people complied with these social or physical distancing guidelines? Yeah, actually. So this is a paper published in Science comparing the number of daily social contacts in Wuhan and Shanghai before and after the outbreak. So on the left here, this shows age of the participant on the bottom and age of the person they interacted with vertically, and darker colors represent more daily social contacts. This is before the outbreak in these two locations, and these figures show the same information during the outbreak. These researchers found that the average number of daily social contacts dropped from 14.6 to about 2 in Wuhan, and from 18.8 to 2.3 in Shanghai. Also, the contacts were primarily with household members during this time. About 94% of daily contacts were with household members in Wuhan. These authors also suggest that this dramatically reduced transmission rates. Here's a figure from a Gallup poll looking at Americans' views of COVID-19. So you can see that Americans recently have, more Americans have expressed that the coronavirus situation is getting worse, shown by this light green line. The dark green line shows the percentage of Americans who say they're isolating completely or mostly from non-household members. So you can see that this kind of peaked in early April. It's fallen off, but still about 44% of people in the latest measurement are saying that they completely or mostly are isolating. Another paper looked at 850 US participants in the 2 weeks after the US declared a national emergency, and most reported having very frequently avoided social gatherings, community events, greeting with handshakes, hugs, and kisses. They also found that compliance was related to age. Older adults tended to engage in this social distancing behavior more, and also compliance rates were higher with those with better working memory capacity, and lower among those reporting symptoms of depression. There are a lot of explanations for that. You might speculate that maybe someone who's experiencing depression might have a harder time complying with these guidelines. This is a figure from the COVID-19 Mobility Data Network, which uses population movement data from Facebook. And the gray lines show the relative change in mobility across US states. The darker line here is the average for the US. The blue line here is Florida. And this shows in Florida, at least, when schools closed, when there was an official shelter-in-place order. And you can see again that people's mobility, how much time they're spending away from home versus in home, moving around, has declined. It's gone back up, but in the latest measurement here, mobility is still about 19% lower in Florida than we'd expect compared to baselines. So given these changes in social interactions, do people feel lonelier or less connected while they're social or physical distancing? A Pew poll found that more than half of, about 52% of people said they felt lonely rarely or none of the time. Only about 8% said they felt lonely most or all of the time. That's really not so different than what we might expect in other time periods. A published paper by Lucetti and colleagues looked at US adults at 3 times before the outbreak, in late March and in late April, and they found no significant changes in self-reported loneliness or feelings of perceptions of loneliness. And they actually found significant increases in perceived availability of support. I receive the social and emotional support that I need. Another paper in New Zealand, not the US, but in New Zealand, compared various perceptions of support and belonging and so on before and after the nationwide lockdown in New Zealand, and also found no significant changes in perceived social support, feelings of belonging, or satisfaction with personal relationships. They actually found significant increases in perceptions that that you have a sense of community with people in your neighborhood, feeling connected to people in your neighborhood. But they did find significantly increased psychological distress. So it's not that people feel fine, but they don't seem to be reporting significantly more loneliness overall based on these studies. Now, I think if we zeroed in on maybe high-risk groups or people who are living alone, we might find different patterns. I think we probably need more data to get a good sense of this. But what I want to point out is, again, loneliness is not the same as being alone. We can meet our need for belonging whether or not we're physical distancing. And loneliness, maybe it's not significantly worse now, but it was a serious public health issue before and will continue to be a serious public health issue after COVID-19, at least the current state of things. I'm going to skip through some things very quickly. I want to mention some work that we've done and that I'm working on with some of my current graduate students, looking at the differences between chronic and daily loneliness. So if I ask you, to what extent do you feel in tune with the people around you, isolated from others, that there are people who care about you and so on? If I measure that every day for a period of 2 weeks, we might find some sort of stable chronic differences. So the person in the middle here is generally lonelier and somewhat stably more lonelier than other people. The person at the top has some pretty lonely times, but they kind of fluctuate quite a bit. The person at the bottom is generally not lonely, but they have some lonely days. So we've collected data from mostly undergraduate students where we try to differentiate between more chronic and more transient experiences of loneliness. And what we find is that if we look at all the differences across participants and over time in these daily experiences of loneliness, only about half of that, based on our data, represents stable differences between people, and about half represents within-person fluctuations from day to day. So even if you're generally not very lonely, it's very common to have lonely experiences. When people report feeling lonelier than they typically feel based on our data, they also tend to report less positive emotions or mood, more negative emotions, more stress and physical health symptoms, poorer sleep quality reported the next morning. And what predicts shifts in loneliness? Well, loneliness is related to time spent alone during the day, but it's also strongly related to the quality of social interactions. What we find is that when people perceive their interactions as responsive and involving perceptions of feeling understood and appreciated and less negativity, they report much lower levels of daily loneliness. So how does closeness develop? What are some things that influence interpersonal attraction? A general principle, according to Eli Finkel and Paul Eastwick, among others, is that instrumentality is fundamental to attraction. We're attracted to people who can help us achieve our goals and whose presence is rewarding. Now, that might include things like physical attractiveness, sense of humor, warmth, having resources that might allow us to have positive experiences. It can also involve what psychologists refer to as self-expansion. In relationships often allow us to expand our sense of efficacy by providing us with novel resources, perspectives, experiences, and so on. Another type of reward can be feeling validated. This is one reason that we tend to like interacting with people who we assume are similar to us. Now, the research on similarity is interesting because when you look at actual similarity and things like personality, it actually doesn't seem to be too important in the scheme of things. What does seem to be important is perceived similarity. So we tend to like interacting with people who we assume are similar to us or who we think are similar to us. Some other predictors of attraction are familiarity and self-disclosure. I want to say a couple things about this. So talking about self-disclosure, Aaron and colleagues pointed out that a key pattern associated with developing close relationships is sustained, escalating, reciprocal, personalistic self-disclosure. So in a kind of classic study, I think, they randomly paired people up, strangers, and asked them to spend 45 minutes taking turns answering these increasingly personal questions. So the first question, given the choice of anyone in the world, whom would you want as a dinner date? The last question, share a personal problem and ask your partner's advice on how he or she might handle it. Also ask your partner to reflect back to you how you seem to be feeling about the problem you've chosen. And number 18, what is your most terrible memory? A little more self-disclosing. So here are some baseline values in red here. The first one is the closeness reported in another study by people who rated their closest, deepest, most involved, most intimate relationship. And the other kind of comparison here is a control condition where they just ask people to engage in small talk. Across 3 studies, they show that self-reported closeness and feeling sort of that you are merged with the other person, let's say, was significantly higher after participants engage in the self-disclosure task compared to the small talk condition. Not to the level of their closest, deepest, most involved relationships, but this task does seem to promote closeness. And this is consistent with other research showing that as relationships develop, we tend to go from talking about a small number of shallow, kind of superficial topics to greater depth and breadth of self-disclosure. But even though there's research suggesting that self-disclosure is important, it's not just that disclosing directly promotes intimacy and closeness. What Harry Rees and Phil Shaver pointed out in a classic paper in 1988 is that intimacy is dynamic and develops through an interpersonal process through what they call perceived partner responsiveness. So the idea here is that person A reveals something personal, private to person B. Person B interprets that through what they call an interpretive filter, and they respond to person A. Person A then perceives that response. And to the degree that person A perceives person B as responsive, to the degree that they feel understood, validated, and cared for, that's going to lead to this process moving them towards greater intimacy and self-disclosure. Over time, remember, there's also person B. This might lead person B to kind of reciprocate. And over time, this kind of interpersonal process might promote intimacy and trust. Another key aspect of attraction is familiarity. In one textbook, Burscheid and Regan said that the familiarity principle of attraction is perhaps the most basic of the general principles of attraction. But in classic work in the 1980s and so on, they generally didn't test this experimentally by manipulating how much people interacted. So in one paper, we randomly assigned people essentially to do that self-disclosure task and to either discuss 2 topics or 6. What we find is that the more people interacted, the more attracted they were to each other, and the more they perceived each other as responsive. They felt understood and cared for. In another study, we randomly assigned undergraduate students to chat through AOL Instant Messenger using anonymous screen names. That dates the study a bit. And we again found that attraction increased as a function of interactions, as did perceived responsiveness, feeling like the other person understood and cared about you. And we found that perceived responsiveness, along with a few other things, feeling like you understand the other person and they understand you, feeling cared for and so on, helped explain why attraction increased over these subsequent interactions in this study. So the point that I want to make here is that there's several things that influence our attraction and influence the development of intimacy and closeness. But I think what's most fundamentally important is the nature of our ongoing interactions, particularly the degree to which we're doing something that the other person is likely to experience as responsive, meaning lead them to feel understood and cared for. So I'm basically out of time, so I just want to quickly mention a few other things. I'm one of 86 co-authors on a very interesting paper, I think, as one of the co-authors, that was led by Samantha Joel and Paul Eastwick, where they brought together a huge team of relationship researchers and looked across 43 longitudinal couple studies with thousands of, I think about 2,000 some measures of individual differences across these studies, more than 2,000 measures of perceptions of the relationship. And they used machine learning, artificial intelligence, let's say, algorithms, to see across all these studies, what are the most robust predictors of relationship quality. Here's a subset of some of the categories of variables. So you can see individual difference variables, a lot of things in here, demographics, personality traits, and relationship-specific perceptions. So this massive study included 43 data sets with romantic couples followed over time for an average of about a year, with more than 11,000 couples. So using machine learning, basically they ran through every possible combination of these predictors in every data set to try to identify what types of things seem to predict relationship satisfaction and relationship satisfaction over time, and what predictors seem to be most robust. And if we use everything that we measured in all of these studies, how much can we predict in relationship outcomes? I'm going to skip over the details. If you're interested in this study, email me and I can send you some additional information. But essentially, what the study demonstrates is that when you look at individual difference variables like personality, that can explain about 19% of relationship satisfaction at the beginning of the study. But our perceptions of our relationship can explain about 45% of the variance. Variance refers to all the differences between couples and so on. Now, when we add these two things together, adding individual differences doesn't actually seem to explain very much over and above these relationship perceptions. And here are a few of the things that were very frequently selected in these models, including some individual differences and some relationship-specific constructs. You'll see perceived partner responsiveness here. This is predicting satisfaction, at least. If you read newspaper articles, they might describe things a little bit differently. But what I want to mention here is that these are a few things that are important, not by no means everything. But I think one of the takeaways from this study is that our relationships aren't just about who we are or who our partner is. It's about how that relationship unfolds over time. And once we look at each individual's perception of the relationship, adding these individual differences, personality characteristics, doesn't actually add a whole lot of explanatory power. So I think that's another reason why our behavior in a relationship, being responsive and focusing on our relationship partner's needs and so on, is fundamentally important. So there are other things I could discuss, but I want to leave a few minutes for questions. I apologize, I use most of the time, but we will, I will follow up with questions that I probably won't have time to answer and post those answers after today's meeting.
Great, thank you very much, Michael. We only have a couple more minutes, but anybody who has questions, please post them in the Q&A button at the bottom of your screen. If we don't get to them right now, which I expect we won't, we will answer them offline and post the answers on our website. So please type away your questions. Michael, I only ask you one question because we are out of time, but given that we're in this worldwide pandemic right now, the global pandemic, do you have any recommendations, particularly for individuals who may be single on their own? They may have lost their job, so they're sitting at home. They are not allowed to go out and meet anyone. Any suggestions on how to mitigate that type of loneliness that comes with that situation?
Well, I will try, again, I'll post answers to the questions. I apologize that I was talking about being responsive and I wasn't responsive to your questions. I will follow up and we'll post the answers after the session. And I'll also try to share some resources. So there's some fantastic resources that different people have put together on guidelines for how you can try to prevent sort of severe loneliness. I would say that if you're feeling severely depressed, more than just feeling a little bit disconnected, if you're feeling severely isolated to the extent that it might indicate sort of an emotional health issue, I'd encourage you to look into resources, seeking counseling. A lot of counselors are doing remote sessions these days, so that's a great way to connect to someone who can give you clear advice. I'm also not a trained clinician, so I wouldn't be the person to address counseling related issues. But if you're just feeling a little disconnected, one of the points I tried to emphasize is that loneliness isn't the same as being alone, and we can meet our need to belong without being very close in terms of physical proximity, particularly given the internet and all the resources that we have to connect with people in very unique ways, social media sites and so on. Now, usage of social media sites can be healthy or unhealthy, so I'm not saying you should spend all your time just interacting on social media sites, but we absolutely can connect to people meaningfully without violating some of these safety guidelines for social distancing. And my perspective is what's most important in connecting is just having those interactions, whether they're remote or not. If you're looking for a romantic relationship, there are also lots of online dating services that can sort of facilitate connecting with people. The one thing I'd say is a lot of relationship researchers are skeptical of some of the claims of algorithms that match based on individual differences. As I mentioned, once we know how two people are interacting and how they perceive the relationship, knowing about who they are in terms of just their personality might explain something, but not a whole lot. Again, my perspective is it's really about what you might think of as chemistry, but once you connect with something, once you connect with someone, how does that interaction unfold and how is that perceived by both people? So I'd say look for creative ways to safely connect to people. And if there's any rule of thumb about relationships, think about what would make the other person feel understood and appreciated and cared for. And that's probably the right thing to do.
Great. Thank you, Michael. And with that, we are out of time. We will send the additional questions to Dr. Maniaci for him to answer offline. They will be posted, the answers will be posted on our website together with a recording. If you have any further questions, please feel free to drop them into the Q&A pop-up here, and we'll get to them shortly. Thank you very much, Dr. Maniaci. Bye-bye.